Hi guys, welcome back to my channel. My name is Ziad, Crohn's disease patient, NHS worker and educator, here bringing you IBD facts and taboo breaking chats. Don't forget to like, comment, share and subscribe on my channel. So let's get started. Hello and welcome to this lesson all about IBD and the risk of cancer. So cancer is defined as the uncontrollable growth of abnormal cells which have activated genes that do not suppress tumor growth. Cancer can be either malignant, which means it can spread around the body causing additional tumours, or it can be benign, which means it does not spread and are defined to one area. With benign tumours, you have a better outlook in terms of prognosis compared to malignant tumours. Those with IBD are at an increased risk of developing certain types of cancers. However, this is not the same as saying those with IBD will get cancer, as there are many factors which will determine the level of risk a person has, such as their age, the coexistence of primary sclerosing cholangitis, their ethnicity, family history, gender, the medications they're on, whether they smoke, as well as specific IBD factors like the amount of bowel that is affected with IBD, the length of time they've lived with IBD, and the severity of intestinal inflammation caused by their IBD. The risk of developing cancer if living with IBD is very difficult to predict, especially as regular colonoscopies and constant monitoring of health through blood tests are part of the follow-up care, which help in the early detection of any abnormalities. So the type of cancers which are related to IBD include cervical, colorectal cancers, lymphoma, and some skin cancers. In cervical cancer, it is a cancer that affects the opening between the vagina and uterus called the cervix in women. Almost all cervical cancers are caused by types of the human papillomavirus, which causes an infection of the cervix. The human papillomavirus, or HPV, can affect the mouth, throat and genitals and is classified as a sexually transmitted disease which can spread from skin-to-skin contact, oral, vaginal and anal sex with someone with the virus. HPV is also responsible for many other cancers such as anal and penile cancers in men. Now, men can have HPV as well, although they rarely display any symptoms of HPV infection, which can occur around the genitalia and include lumps, sores, unusual growths, or warts around the genitals. Men who have a weakened immune system or engage in anal sex are at a risk of developing anal and penile cancer due to HPV infection. Women with IBD who are on immunosuppressants have an increased risk of developing cervical cancer as they are more susceptible to contracting HPV. Cervical cancer often grows slowly and the severity of the cancer will depend on how large it has grown and if it has spread to other parts of the body, and so it is important to attend cervical screening appointments that help detect any early signs of cervical cancer. In lymphoma, it is a cancer of the lymph glands or lymphatic system which affects the lymphocytes of the immune system. There are two main types of lymphoma, known as Hodgkin lymphoma and non-Hodgkin's lymphoma. Normally, white blood cells have some time to rest in between multiplying themselves to allow themselves to mature. However, in lymphoma, some of the white blood cells are abnormal and do not stop to rest and so multiply very quickly. This means that there are many white blood cells that have not developed properly and are unable to fight off infections, and so they start to collect in the lymph nodes, spleen, or bone marrow, causing tumours to grow in these places. Those with IBD who are on medications that suppress the immune system, such as azathioprine and biologics, are at an increased risk of developing lymphoma, with the risk increasing the longer you are on the medication. Looking at skin cancer, those with IBD who are on medications that suppress the immune system, such as biologics, are at an increased risk of developing skin cancers, as some of these drugs can make the skin more sensitive to sunlight, increasing the risk of developing skin cancer. There are many different types of skin cancers, but the two main types are melanoma and non-melanoma skin cancers. With colorectal cancer, those who have been living with IBD for over 8 years, where the inflammation affects the colon, are at an increased risk of developing colorectal cancer. Now, colorectal cancer is also known as bowel cancer, and because the inflammation affects the mucosal layer of the intestine and constant exposure to inflammation causes damage to the layers, this causes the cells to become abnormal. This increases the risk that these abnormal cells will have genes that have mutated, turning that cell into a cancer cell, which can cause them to grow and reproduce uncontrollably into cancer. It is important to keep a close eye on the symptoms you are experiencing, especially if on medication that suppresses the immune system, as symptoms of bowel cancer can be very subtle, and any concerns over your health must be brought to the attention of your doctor immediately. So to summarize, we've looked at the definition of cancer and the types of cancers that are related to IBD.